Hello, and welcome to the Mind by Design podcast. I'm your host, Jana Parker, licensed educational psychologist, parent coach, and educational consultant. Visit themindbydesign.com to find resources and access our services, and please follow us at The Mind by Design on both Facebook and Instagram. Welcome back to the Mind by Design podcast. I'm here with Harmony King from the Key Collective today. Welcome.
Thank you. Thank you for having me. I so
Absolutely.
appreciate meeting with you.
Yeah, my pleasure. So yeah, I'm really interested to hear about the Key Collective because I hear it is a little different than what than maybe places I'm used to referring people to. And so I'd love to hear about the practice and what it is that you offer. And I'll probably ask more questions as you start talking.
Yeah, no problem. Thank you so much. So, Key Collective, it is different, and there's not a lot of places like us. So, it feels really good to be providing this service. So we know that it's needed. We've been around for about 10 years. We were mostly in LA for the last 10 years, but we've recently expanded services up into the Bay Area. So it's three service areas that we're providing. So one of our services is mentoring. And our mentorship program happens in clients' homes and we'll meet clients out in the community. So it's really unique to be able to have that service brought to you, in the real world, getting to practice some new tools out, yeah, just in the real world.
Right.
Um, so that's one area. Another area is parent coaching. And our third area of service is 24/7 companion care. So I'll give you a little more detail of each of
Yeah.
those areas.
Great.
And first, I'll tell you more about our clients. So our clients are usually 13 to 35. We do work with older adults as long as there's a good fit, in our staff. But generally, we're working with folks 13 to 35. The issue areas that we work with are pretty varied. So we have clients who are experiencing neurodiverse support needs. We have a lot of clients who are on the spectrum. We have clients who are in early recovery. We have clients who are struggling with mental health. And we have, yeah, that's pretty much mostly it. And so the way that they all kind of overlap, or the way that we can help them, is really with those sort of like structure building, routine building, life skills. Our clients tend to need help with passion development, finding hobbies. Like a lot of people are coming to us after they've done really amazing programs and worked, with other clinicians to get them, back into a situation where they don't need as high a level of care, but they really need help with the day to day and taking the tools that they learned from other clinicians and really integrating them into their, daily life. So some of the things we might do with our clients, like in our mentorship program, for instance, we might, go try out some new things and see what sticks, see if we can get some hobbies in place. We might help a client develop a schedule that they can stick to for the day. We might help a client with cooking classes. They might be trying to live independently for the first time in their life and just need support with, those types of things.
Yeah.
We might help some of our like mental health clients manage medication. So it wouldn't be that we're administering medication. We don't do that. We don't do anything clinical, but we might help, keep them on track, set up a schedule, set up reminders, check in with them about, oh, it's 8 a.m. Did you take your medicine? That kind of thing. What else do we do? We do job search support. We can help clients get into different sort of like social programs, like meetups or
Mhm.
clubs, that kind of thing. Like there might be a need for more relational work. So our mentors can really be that support system for our client. They can really practice role modeling and having awkward conversations and giving advice on how to get through the anxiety of that kind of thing. So that's our mentorship program and how we work with our clients in that. With our parent coaching, we really try to focus on helping parents create healthy boundaries, maybe strategies for self-care, compassionate communication. We might also help them, kind of buffer, if you will, like really saying, okay, well, that's really, your son or daughter's lane, and your lane is over here, and let's bring the focus back to you. It's not couples counseling, it's not family therapy, it's really developing a support system for the parent individual.
Yeah.
And I think that's pretty much it with our parent coaching piece. For our 24/7 companion care, it's really a unique model. It really is what it sounds like. We have our companions move in with the client.
Mhm.
So a lot of our clients who are coming to us for this service they tend to have a higher acuity or maybe a history of a higher acuity. So again, the clientele could be very, it could be a pretty wide range of support needs, but I would say that, a lot of those clients have maybe long-term support needs for living independently, or maybe they've struggled with substance abuse and have gone in and out of programs, or maybe they're treatment resistant and they don't want to go to another program. They want the support to come to them, though. They're willing and open to get support, but they really want to try something different, more one-on-one. We also have clients in that program who have caregivers who need a break. So we might come in and support, the family as a system so that primary caregivers can go take a vacation or whatever they need to do.
Right.
We also go on vacations with clients if the family needs, like, a third set of hands just to help with the day to day. Yeah. Or sometimes we have clients who have pretty high level of mental health care needs, and they're in long-term residential, but they want to come home and take a break, and see the family. So we can help provide that sort of time and support. And then I'm also trying to think of any other situations. Our companion care model is also really great, I think, for families that are at high conflict. Sometimes having a third person in the home who can, kind of keep things on track and model what, good relationship behavior, good just daily independent living behavior looks like, and can really kind of take the focus where it needs to be. I think that can be a really great solution for families too.
Yeah.
Those are like our three main service areas. Another sort of thing that we provide is clinical team building. So a lot of times we'll have families who come to us and they're like, there's a sense of urgency or maybe crisis, and they are overwhelmed. They don't know where to begin. So we can help them develop teams, and those teams could be all kinds of which ways, like psychiatrists, we help with pediatricians, we help get OT.
So they coordinate the
We
like kind of
coordinate
find
care.
the people.
Yeah, we can coordinate in like a case management kind of way.
Yeah.
So that's why it's really great to know all kinds of professionals who are working with, other neurodiverse folks or
Right.
people in early recovery, people who've got some sort of co-occurring mix of all three. It could really be a lot to take on as an individual or even as a family. So having some support is really great. So we want to be there as much as we can. We know a lot of our families are really struggling when they come to us. So
Yeah. Okay, so tell me, how do who are your staff?
Great question. So we have our mentors and we have our companions. Our mentors, when we're bringing on mentors to the team, we're looking for two things really. One, an educational background that is relevant to mentoring, whether it's psychology background or behavioral sciences or something in that realm, school counseling even. Or maybe they're working on their licensure to become a therapist or applying to grad school, but we really want like some level of education. And then we want a life experience that will be useful to our clients. So some of our mentors have, experience in recovery themselves, or they've had a sibling with autism, and they can really speak to, what it looks like to live independently, and they can really support in a meaningful and caring way. We've had clients who overcame their own mental health challenges, and their level of relatability is just so impactful, Um, and then with our companions, they're living in a very similar situation. We're looking for that education background, and we're also looking for a lived experience of some sort. There is more clinical training with our companions, but all of our mentors and companions see our clinical director once a week. They have their own one-on-ones, so they're provided that sort of like therapeutic oversight, but still able to discuss things in a way that keeps our work in the mentor lane.
Yeah.
And not replacing, we're not taking the place of a clinician. But we want to have that sort of knowledge and informed practice when we're mentoring and companioning.
What about for parent coaching?
Same thing, parent coaching, same thing. So like some of our parent coaches are in PsyD programs or they're LMFTs. They've usually have a private practice that they're working on, and they work with us on a contractor level. So they've got a rich, experience for their parent coaching. Some of our parent coaches, they might have been a school counselor for a long time, and now they're, developing their own private practice. But again, it's that same like education plus lived experience.
Yeah.
Yeah.
How do families find you? And then what's the intake process like?
So families can find us online. We have a website, keycollective.com. And the intake process is usually a conversation with Chandler Green. He's our executive director. He does all of our intakes. He's fantastic. He's also a therapist. He is just truly gifted at pairing, our staff with our clients. And so they'll usually do an intake, once that's all taken care of and we can pair them with a mentor or a companion. Well, I guess I should say for the mentors, we'll do an introduction sort of meet and greet. And if all is well, we'll move right into the work. With companions, there's not always necessarily time for that introductory meet and greet. Sometimes because there is like a level of crisis or sense of urgency, we want to get someone to them right away. So for our mentoring services, you can find them in LA and in the Bay Area. And those are, again, in person and in the community. For our companion care, we'll go anywhere in the country. So we'll fly our companions wherever they need it, basically.
Wow. That's great. And so
and parent coaching is usually done virtual. So
okay, got it.
Anywhere.
How is it, do you have like a kind of a treatment plan, or, like when you think, okay, we're going to set this 13-year-old up with a mentor, is there a plan for like what the goals are of that mentorship and how many times a week they need to see them, and, and then what other kinds of things are happening during it? And then is there like cross communication between the mentor or the clinical director and whatever other specialists the person is seeing?
Yeah, great question again. So, absolutely. So, our mentors typically we want to meet with our clients for 4 hours, 4 hours a week. So it comes out to like 2 2-hour sessions. And we'll do that per month. So it comes out to about 16 hours a month
Okay.
of time. A lot of families will actually do 3 or 4 sessions. It really depends. So that sort of program is highly individualized, but we do need a minimum of 2 sessions a week.
Okay.
That's really where we see, the best outcomes
Yeah.
and can really like get into that integration process. So that is for a mentoring program. And with each individual client, the goals are going to be different. It
Mhm.
really depends on the client. And so the goal might be that, we want to see a client employed and maybe making a plan to move out of parents' house by 3 months from now or 6 months from now or whatever it is. It could be, the goal could be that we want to get sober again and get into a program that works for them, or find a recovery coach that they're going to be able to work with weekly. The goal could be relational work, and finding a club to join that's going to serve that, piece in their life.
Mhm.
Um, it could be independent living skills, right? So by the end of the month, we want to be able to cook for, different recipes with ease, be able to go to the grocery store and buy them, the ingredients for them, and etc.
Yeah.
So yeah, we really try to be goal oriented and have very clear action steps for those goals.
Mhm. And then you kind of decide month to month if you continue, if there's like a continued need for that.
Yeah, exactly. So we usually do, we bill at the beginning of the month. And so, yeah, services are covered for that month. We don't have any contracts. If a family wants to, stay with us for 4 or 5, 6 months, they can. We have some clients who have been with us for years. It really just depends on, what their needs are.
Yeah.
A lot of times they'll, really develop a sweet bond with their mentor, and it could carry on for who knows, years and years,
Yeah.
right? So yeah.
Um, and so, yeah, so then if somebody is connected with different kinds of specialists for whatever reason, how do how does that communication happen
Yeah.
between people, or does it?
So we will communicate with anyone that we have signed ROIs for release of information. So if it's, a client who has mental health needs, then we definitely want to be, in communication with their psychiatrist or their therapist.
Yeah.
I think it's also a really great collaboration in those types of situations because we are there in the home and in the community and have a different level of observation that we can communicate with, their other support team. And it's done in a very trusted, client-centered way to say like, yeah, this medication is seems to be going really well, and this is how we see that happening, or this is where we hear them, talking about how it's a struggle for them. And so we can really collaborate in an intentional and individualized way.
Yeah.
Yeah, and so in a mental health kind of like companion care situation, we might be communicating with the team every week, in a different kind of situation, maybe like in a mentoring capacity. We might be talking to teachers. That could happen maybe once a quarter if it makes sense, or it really just depends. But we always want to have ROI signed. We always want to be, fully transparent with client buy-in, and really, yeah, have completely client-centered care.
Yeah. Well, this sounds like a great kind of alternative. I have a couple, we work with mostly kids and young adults, neurodiverse, mental health,
Mhm.
kids kind of like maybe hanging out with the wrong people, getting
Mhm.
themselves into like risky situations, or really just kind of trying to build their independence. And I could see this as a good option for like having somebody to be with who's a positive influence and helping somebody work toward their goals after school a couple times a week.
Yeah.
Yeah.
Yeah, absolutely. And mentors are not clinicians, they're not friends, quote unquote, right? They're going to do things that friends can't really show up for,
Hmm.
and they're going to relate in a way that clinicians can't, because that wouldn't really be appropriate, right, for that
Right.
clinician client patient relationship. So it's really, I think it's really cool,
Yeah.
and they can really connect in a totally unique way and work on things that are a little more pragmatic, you know?
Hmm.
So yeah, I think
So
it's
you
great for all of those types of clients that you just named. Absolutely.
Yeah. And you have, and I've also worked a lot in, with the population of young adults need, who want to maybe live independently, or who
Mhm.
are trying to get there at some point, that transitional
Mhm.
aged youth, right? And, trying to get jobs, learn how to take care of themselves at home, be more independent,
Mhm.
and make that transition. So I've had
Yeah.
I think this is great for young adults like that
Yeah,
who, you know,
absolutely.
yeah.
A large portion of our clients would definitely fit that sort of support need.
Hmm.
And also, we've been working with a lot of clients who are struggling with depression, and yeah, just getting up can be a struggle. And so, when we have those sort of support needs, like the other things right in our life kind of go to the wayside.
Yeah.
So, um, yeah, we can definitely help with all
Are,
those sort of like independent living skills.
yeah. I mean, I'm thinking about families who might be, because I'm assuming you're not a vendor with the San Andreas Regional Center, right?
We're in the process of being a vendor with Golden Gate. And so I think
Oh,
that once that happens, we'll be able to be vendors with all of the other regional centers.
yeah. Yeah.
But
Well, because
yeah.
I can see that being really positive, that relationship, right? Because they can then help to fund this kind
Yeah.
of service. And also, there are parents who have chosen this self-determination route where
Mhm.
they get their money and then they get to like kind of disperse it to they get to find their own vendors, basically, who don't have to be vendors of San Andreas Regional Center. I'd say San Andreas just because I'm in the South Bay, but um yeah, I mean, I can see this being a good option for families like that.
Yeah, absolutely. And that's always so great when you can pick the personalized care that you need to,
Yeah, yeah,
definitely.
absolutely. Yeah, cool.
Yeah.
Well, great. And so, I don't know, do you feel like there's anything you haven't um let us know?
I don't think so.
And parents can just find you on your website,
Find us on our
keycollective.com.
website. Yep. I'm happy to share, any of my info with you too, in case you have families that reach out to you directly. But my email is also harmony@keycollective.com. Always here for questions. And yeah, we're happy to help. We just want to see people get the care they need. And we know that the whole reason that, Key Collective came to be was because our founders had their own experiences growing up, and um, they found that having a mentor in their life was really something that helped them, you know, really move into adulthood successfully and put the sort of challenges that they were having in the past. So we really believe in mentorship and companion care, and would be more than happy to talk to anyone who thinks they need it. So
Wonderful. Well, thanks so much for sharing about Key Collective. And yeah, it sounds like a really great asset to our community. And I'm glad it's up here from Southern California and expanding into the Bay Area.
yeah, thank you. Thank you so much.
All right. Well, thanks, listeners, for tuning in again. And hopefully you found something useful here with Key Collective. Thank you for listening to this episode of the Mind by Design podcast. If you enjoyed what you heard, please share it with a friend. And if you haven't already, subscribe, rate, and review on your favorite podcast player. And if you have any questions or comments or would like to be a guest on my show, you can reach me directly at jana@themindbydesign.com or just visit the website at www.themindbydesign.com. Thank you for listening, and remember, I'm here to help.